So today's guest is one of the most sought-after facial plastic surgeons in the world. Dr. Jason Diamond is a double board certified facial plastic and reconstructive surgeon and a nationally recognized leader in aesthetic medicine, founder of the Diamond Face Institute in Beverly Hills and the luxury skincare brand Medicine. He's known for celebrity clientele and for pioneering natural-looking facial procedures, including the Diamond Instafacial. Dr. Diamond, it is amazing to be back speaking with you.
Great to see you. Thank you.
So let's start at the beginning. Was the goal always to be one of the world's most sought-after plastic surgeons? And how did you end up here?
So I've always had, once I, outgrew my immature youth, once I hit like late teens and I got off the video games and everything else, I sort of developed a very significant one-track mind. It's just who I am and who I've always been. And anything I do, I become sort of obsessive about just knowing the most about it, being the best at it. And that became my personality and my mindset when I found out that I really loved, facial anatomy. And I said, I just want to be the most experienced, the most knowledgeable, and the best at working on the face. And that led me down the road of becoming a facial plastic surgeon. And so I spent ungodly amounts of time studying and learning. When most people were out making money and starting their practices, I was like, I'm not, I need to spend more time studying and learning. So I sacrificed my career. I sacrificed my money making ability for years to learn and learn and learn until I knew, okay, I can come out of the gates here and be the absolute best. And so, yeah, so anything I do, I want to be the best at. So it's just my personality.
Well, I mean, everybody's gone to you. So, like you're the name. You must feel so proud. Like, I guess when you start off and you have a vision and you have a mission, so often there are so many challenges that come along the way.
Yeah, there are always going to be a lot of challenges, but the one thing for sure that I've learned is that people who really focus everything they have from every angle on the main mission, those are the people who are building that foundation that just is so solid that can lead you up to the top of that pyramid. My whole life, everything I did was about being the best facial plastic, being the best at what I was doing. And so, again, even the way that I was exercising was to keep my body in shape to be able to do these procedures. The way I was, everything about my life was geared towards making sure could be the absolute top of the food chain in this.
So when a new patient sits in your chair and says, I just want to look younger, what does youth actually mean to you today?
It's funny because, we've all been through it when you are young, and people, people are young, you sort of take it for granted, right? Like what's the saying? Youth is wasted on the young, right? You totally take it for granted.
You never appreciate anything till it's gone. Psychology of human nature.
That's right. And then as soon as you start to age, which we all do, you start to see things and you're like, oh, that was never there before. And so for me, it's always been about making somebody feel their best. So what does youth mean? It means making somebody look healthy, the best version of themselves, right? It's not about removing every wrinkle, right? I mean, you can over tighten somebody. It's not about over volumizing a face, right? Like we like to say, the saying that we like to say in this business is that the face is kind of like a beach ball. When you're young, it's like a beach ball that's taut, filled with air, and as you get older, it kind of loses air, like a beach ball getting flaccid. And so but then there's a lot of components that go into that analogy, but it's not a matter of just blowing somebody back up. I mean, you can overfill somebody, you can over tighten somebody. So it's not about that. It's about finding that right balance of, maybe tightening up something that's loosened, maybe restoring volume that's been lost, but getting it right back to like that person's maximum to make them the best version of themselves.
There's so much talk now of deep plane facelift. So like everybody wants a deep plane facelift. So what do you think about that?
When I learned how to do this work, I came out to Los Angeles. The reason I'm here is all the most famous surgeons in the world were here. And I wanted to learn from the best in the business. And the most famous facelift surgeon in the world at the time, his name was Frank Kamer, was right here, and he became one of my mentors, and I spent a lot of time with him. He learned the deep plane facelift, and so when I started my practice, we're talking 25 years ago, I learned every facelift technique there is. And I felt that was I liked that one the best. And it's what I started my career on and what I built my career on. And this is before anybody even ever really heard the term. And then I was on this TV show called Dr. 90210, and I was the face specialist on it. We're talking in 2002, 2003. I had developed a facelift practice early on in my career, which is very unusual. And when I was on that show, Dr. 90210, I was talking about the deep plane facelift, like openly. The whole world was hearing me talk about it. Over the years, as I developed my reputation, people would come in, they'd say, they'd say, Doc, just do what you think. I didn't even really need to talk about it anymore. So in like 2010, 2012, I really wasn't even using the term that much. Well, about a few years ago, all of a sudden, this weird phenomenon happened. All of a sudden, people started coming in asking about the deep plane facelift. And then it was like increasing and increasing. Now I don't think I see a patient who doesn't ask if we're going to do a deep plane facelift. So clearly, it has been marketed somewhere along the way in social media where the term went viral a few years ago. So the point is, this is nothing new. This technique's been around since like the night. It's 40 years old now, this technique. But it is a great technique. I love the technique, and it's great for good candidates. But it's not ideal for everybody. One person's deep plane facelift is not the same as somebody else's deep plane facelift. People can easily market these things. So it's just important your surgeon has a lot of experience with all the different techniques.
Once you've gone through the procedure, the biggest worry you then have is the scar. But I guess, that's where like the Lyma laser comes in and the Pro, that, you can accelerate the wound healing. So I guess, what have you seen the Lyma laser do for scarring and the speed of recovery?
When people come to me, my clientele, they often want to do everything they can to max where money's not really an issue, and they want to do everything they can to expedite the healing. And so we'll tell them, okay, these are the extra things. Like, the reality is, with the way we do these surgeries, you're going to heal beautifully anyway. But if you want to do everything you can, then there's a couple things we would add. And having them use the Lyma laser in conjunction with medicine, with Dr. Diamond's medicine, to stimulate cellular turnover, to help wound healing capabilities, to help decrease inflammation. All those things can be added benefits. And once people start using it, they just love it. And many people end up just continuing even after they've healed, just to use it,
Going on, non-surgical treatments like, Botox and fillers, they just have a ceiling. Are you seeing people opting for a facelift at a younger age now because of this?
I think the straightforward answer is yes. I believe that that's true. Fillers became very popular probably around 2003, 2004. That's right around the time the hyaluronic acids became FDA approved in this country, Restylane, Juvederm, things like that. Over the past 20 years, I mean, you'd see, I'm being a little facetious, but you could almost go to your hairdresser and get fillers by someone at the hairdresser. But like, fillers are done everywhere. It became
in the UK, not even your hairdresser.
every street corner you can get fillers on, and they can look really good and they can be real quick and easy. People were like, oh, this is my answer. They're going to run into the med spa. Well, I think what happened is, over the years, we've reached a tipping point now where people realize this is not the answer necessarily for many, many problems that it was promoted to be the answer for. Now we've all seen, and I've seen it for years, but now even lay people have seen, people who are overfilled, people whose cheeks look puffy, and people have had bad complications from fillers, and stories. Now it's out there that all the surgeons who have seen all these faces full of fillers make the facelift more difficult. Like, I think the word is out. I think we've reached a tipping point where people are like, okay, fillers is not really, is not the be all end all, and should not be done as aggressively as it's been done for the past 20 years. And so I think people now have definitely shifted more towards saying, okay, I think surgical option may be better and maybe more natural, maybe born beautiful. As an expert myself who does both, I've been doing facial injections for 25 years, but I've never done them the standard filler way. So the standard filler world, it's known as dermal fillers. I'm using air quotes for people who can't see. What does that mean? That means fillers are going right underneath the skin in the dermis or the subdermis, right? And I never really agreed with that as a surgeon because I knew that if something's right on the skin, all it's going to do is weigh things down. I've never done it that way. I've always injected, when I'm doing fillers, I've created the technique I call diamond facial sculpting, where I'm injecting on the bony surfaces, only on the perimeters, only laterally, just to create angular, like V-shaped contours, never in the center of the cheeks or around the jowls. And I'll tell you, as the expert who does both, in many situations, I can give somebody a much more natural and beautiful result from a surgical procedure than we can from having the best practices of filler or facial sculpting done in many instances. And I think people are realizing that now too. There are many people who we have taken through long parts of their career with facial sculpting, and people often think, like, that person looks amazing, they must have had a facelift. And you see all these things on radar online and all these TikTok videos of these top doctors talking about, oh my, look how good this person looks, they've had to have a facelift, and look, I think I can see a scar. I'm telling you, a large majority of the time those are my patients, and those radar online articles and those TikTok doctors are way off on what they're even saying that person had done. And many times it's not surgery, it's facial sculpting, where you look angular, you look lifted, and you look like your best. And just as a little funny thing, I've had many of these types of patients who will literally call me myself and say, will you tell that doctor to stop posting about, he's making everyone think I had a face, and then I'll be like, I don't even know what you're talking about. So I'll go to that doctor's TikTok or whatever, and I'll be like, look, patient X, look, she's had a facelift. I can tell because you can see this and this. And I'm watching this video going, he's not even off. So I'll literally, at the request of my patients, I'll call this guy who I don't know. He knows who I am. And I'll be like, yo, bro, you're way off. Like, what you're saying they haven't had that. And you might want to like check what you're saying. And it's just a common thing that I see.
And what do you think the mistakes people are making with the surgery?
So like what we like to say here is we have an invisible signature. Like, people know they look great. So it's too good to be true, but you can't identify what it is because it's completely natural with no visible scars. And that's what I find essential to a successful surgery. So what do I see that are the big mistakes? I would say being too tight doesn't necessarily look good. Being overfilled with volume doesn't necessarily look good. And I see a lot of that. When you try and pull somebody too tight, you can create these weird lines, these weird streaks, these weird muscle movements. There are a variety of complications or unsuccessful results, let's say.
And what are the telltales that give away the fact that somebody's had surgery or work done?
If somebody's got an unnatural tightness to them, and when that happens, sometimes you see these like lines that kind of streak up like this. Like, you'll see like kind of this separation where they've got this line. We call it the lateral swoop deformity. That's a common telltale sign. If somebody's earlobes are pulled down and distorted, you can spot it from a mile away. That's a telltale sign. When there are asymmetries where one side looks one way, the other side looks another way. When the cheeks are too filled in the center, that's often a telltale sign. So when there's like an unnatural hollowness underneath the neck in relation to the rest of the jawline, we call that a cobra neck deformity. That's a telltale sign. There's a lot of telltale signs, but basically someone looking unnatural, someone looking just like looking like they've had something done. That's a telltale sign.
Thank you so much for speaking to us today and kicking off our Science of Youth series. Don't forget to check back for part 2 of Lyma's Science of Youth podcast with Dr. Diamond.